The COVID-19 crisis is causing a great deal of concern in the UK and the rest of the world. And notwithstanding individuals who've got heart conditions where the concern is even greater, waiting lists have been suspended in the NHS. And if you've got a heart condition or you've recently undergone heart surgery under my care, then it may well be that you're on certain tablets and medicines. And I wanted to clarify the importance of these medicines. There are certain types of drugs called ACE inhibitors, perindopril, ramipril, enalapril, or angiotensin receptor blockers like candesartan and losartan. These drugs are very important for heart function. They help the heart to function, they help the heart to recover from heart surgery, and they also modulate in a good way your blood pressure. There is some speculation in the literature about whether or not actually these drugs can make it easier for the COVID-19 virus to attack your cells. This is theory, there is no proof, and there may be equally enough theory to suggest that these drugs could be helpful rather than harmful. So the current advice is that if you're on these drugs, you stay on them. You only will need to modulate these drugs for other reasons given to you either by your doctor or by me if you're one of my patients. So stay on them. Now, the other speculation is about non-steroidal anti-inflammatory drugs, Brufen, for example. Now, these drugs are very important for the control of pain for short periods after heart surgery. The speculation is not proven, but currently, generally the advice is that if paracetamol is enough to deal with your pain, then that's what I would suggest that you take post-operatively. If you've got a temperature, paracetamol is also very good at bringing your temperature down. Another drug for post-operative care might be codeine. Remember, there are certain drugs that have a combination of codeine and paracetamol in them, things like cocodamol and codidromol. And if you're taking those, then you don't need to take paracetamol as well, because the paracetamol is contained within that combination. So for now, the general consensus is that if you're on an ACE inhibitor or an angiotensin receptor blocker, stay on them. If you need pain control or temperature control, paracetamol should be enough, or use codeine. And for now, just avoid non-steroidals until we understand this drug a little better. I hope that helps. More updates for you to try and keep you healthy during this difficult time over the next few days. Stay safe, stay indoors, stay healthy.